Thank you for taking the time to attend this Zoom meeting. My name is Dimple Zaveri, and I'm a board-certified ophthalmologist practicing in New Orleans for 25 years. Today, I'm going to talk about the importance of regular eye exams and preventing vision loss with a great emphasis on diabetic patients. Getting an eye exam is an important part of staying healthy. The American Academy of Ophthalmology recommends that all adults get a complete eye exam at age 40, even if you have no problems with your vision. This is because early signs of disease and changes in vision often begin at this age. A baseline screening gives your doctor a beginning picture of your eye health, and during future eye exams, they can see changes by comparing the results of this baseline screening. So getting eye health screening at 40 is just as important as getting a mammogram at 40 or a colonoscopy at 45. For people with eye conditions or risk factors, this eye exam should not wait till 40. These risk factors include diabetes, high blood pressure, and a family history of eye disease. Baseline eye screening not only detects eye diseases, but it also detects systemic diseases like blood pressure and diabetes. And it provides greater chance of early treatment and preservation of vision. Two important facts about eye diseases are that they cause eye damage without you knowing it, and early treatment often has a good outcome. So most of eye diseases are preventable with early diagnosis. Again, emphasizing this, that early treatment prevents eye diseases and an early exam helps guide this early treatment. What are common eye diseases? Common eye diseases are cataracts, glaucoma, and diabetic retinopathy. Cataracts, as we all know, are very common. We often think of them as problems of the seniors, but their risk increases with age 40. And these are treatable with surgery. So an early eye exam can detect them and can preserve your vision. Glaucoma. Glaucoma is a disease that has no symptoms until vision loss is extensive, and this vision loss is irreversible. So again, early detection and treatment prevents or delays this loss of vision. Glaucoma tends to be hereditary and is more common in the African Americans. So if you have a family history, you should get your eyes checked. Lastly is diabetic retinopathy. Diabetic retinopathy is the leading cause of blindness affecting working-aged adults. Statistics show that 7.7 million in 2010 had diabetic retinopathy, and this number will increase to 11.3 million in 2030 and 14.6 million in 2050. Unfortunately, diabetics do not receive treatment in time to reduce this vision loss. Nearly 1/4 of all the diabetics do not even know that they have it. Effective treatments are available for reducing this risk of blindness from diabetic retinopathy. Again, let me emphasize that this is a disease that's detectable on eye exams. It is treatable and preventable. CDC says that 90% of the vision loss from diabetes can be prevented. Studies show that only 60% of the diabetics are not getting their eye exams. So what is diabetes? Everybody knows diabetes is a disease that affects the body's ability to use insulin, and so blood glucose or sugar levels are high. These high levels cause damage to the heart, kidney, and blood vessels, especially the blood vessels in the eyes. The good thing about the eyes is that you can see it on an exam. And even if the diabetes is controlled, it can still affect your eyes. So eye exam, again, is very important. Early detection is the key. So people with diabetes should get annual eye exams before they have signs of vision loss. Diabetic eye problems include diabetic retinopathy, diabetic macular edema, and cataracts and glaucoma that I talked about earlier. Diabetic retinopathy is when blood vessels in the retina swell, leak, and new abnormal blood vessels grow on the surface of the retina. These abnormal blood vessels bleed in the eye and they cause vision loss. So they have to be treated with laser or injections before they have been formed. Diabetic macular edema is swelling in the center of the vision, which is the macula, which too, if severe, it causes permanent vision loss and has to be treated early. Lastly, diabetes is also a risk factor for strokes in the eye, which also cause irreversible vision loss. Treatment options for diabetes are regular checkups. And if you go to ophthalmologist offices, they do fluorescein dye testing, which is an injection in your veins, and we see pictures of it in the eyes, and this detects these abnormal blood vessels. These are then treated with injections or laser treatment that are performed by retina specialists. So it is crucial to see these specialists and get these changes treated if they are present in your eyes. In conclusion, the key to all eye diseases is eye exams. And this AI machine will take pictures of your eyes, send it to eye specialists like me, and we can direct you on the next steps. Vision loss can be prevented, and hence it is very important to have regular eye exams. If you have any questions, feel free to ask me now.